Cuba is famous for its excellent healthcare system, which is free of charge for its citizens. But how can a developing country like Cuba offer such a high quality of free healthcare? We went to meet Dr. Gisela and joined her as she did her rounds in the neighborhood. But what if you live in a developing country where access to healthcare is not simply a given fact? In the Philippines, we meet Emma. She's not a doctor, but a community health worker. We learn how she, together with her colleagues, helps her neighbors and organizes them to stand up for their right to good health. In Havana, Cuba's sunny capital, we meet Soledad. She lives with her family in temporary accommodation provided by the government.
Donde antes nosotros vivíamos, antes de estar aquí, en la casa estaba en muy mal estado. El techo estaba como que explotado, se veían las cabillas, las paredes cuarteadas, ¿entiendes? El gobierno decidió que no podíamos estar ahí, ¿entiendes? Porque iba a ser un riesgo si pasaba algo, ¿entiendes? Papito, ven.
Soledad and Victor have just learnt that they have a second baby on the way.
Nosotros estamos en espera de otro bebé, además del que tenemos. Entonces tenemos mucha alegría, mucho entusiasmo. Aunque no del todo, porque estamos un poco apretados en la casita, pero estamos muy contentos.
Dr. Gisela, the neighborhood doctor, visits the local residents at least once a year. Soledad and her family are considered risk patients, being one of the poorer families in the community. Dr. Gisela does her best to visit them more often.
Buena doctora se preocupa, te viene a visitar, si el niño le da fiebre o si le hace falta cualquier cosa, no sé, una medicina, hay momentos te atiende de lo más bien.
Soledad's pregnancy will be closely monitored. Dr. Gisela asks her to come and see her at her practice. In Manila, the capital of the Philippines, we visit Parañaque, one of the city's many slums. Jerry and his family live in a house located in a flood area. Twice a year, their home is underwater.
Mahirap po dito. Puro tubig po yung ilalim lahat dito. Puro tubig yan. Dagat kasi ito eh.
Kasi pag naulan dito na bagyo, minsan nabaha po. Naabot pa nga dito ang tubig. Kaya hirap din po kami kasi hindi rin po kami makalis kasi wala rin po kami mapunta kung saan. Eh, kulang nga po yung namin.
Like many other people in the Philippines, Jerry works in the informal sector.
Pinipilit ko magtrabaho kahit may sakit. Pinipilit ko magtrabaho para may makain mga anak ko, mga pamilya ko.
On a good day, he earns approximately €4. Going to see a doctor is not a matter of course for Jerry. Public health care in the Philippines is under-resourced and thus often of poor quality. In slums like Parañaque, there aren't even public health care services. The only options are expensive private hospitals. But for a poor family like Jerry's, this is out of the question. Where the state is failing, civil society initiatives emerge. The Council for Health and Development, the CHD, is a national organization that provides healthcare programs in 65 poor communities. They're also active in Parañaque. The CHD offers training to local people like Emma.
Ako ngayon ay isang community health worker dito sa aming lugar sa Parañaque. Kami ay tinraining ng community health development. Sinanay kami sa gawaing pagsasanay para makatulong sa aming komunidad sa simpleng sakit, sa pagdadiagnose ng mga iba't ibang uri ng sakit at paano ito malunasan. po, galing din ako sa mahirap na pamilya. Naranasan ko yung lahat-lahat ng hirap sa buhay na wala kang pera, wala kang panggamot, wala kang pera, hindi ka makapunta ng hospital. Kaya nung magkaroon ng training, talagang sumali ako.
Emma and her colleagues tour the community regularly. Today they met a young mother who recently gave birth, but doesn't produce mother's milk. The baby is very weak because of malnutrition. There's no money for formula milk, so she tries to feed her child with water used to cook rice. Emma and the group try to find a solution. In contrast to the Philippine government, the Cuban government provides free health care to all its citizens.
La visita a la consulta de los pacientes es gratuita, no se le cobra nada. La visita en el terreno al paciente es gratuita, no se le cobra nada. Nuestro país hace un gran esfuerzo por mantener este estatus para el bien de la población.
Tener que pagar nosotros la salud sería muy difícil porque nosotros somos de muy bajos ingresos. Entonces sería un serio problema.
Ejemplo, nosotros para poder garantizar la comida no podemos coger y comprarnos un pullover o un par de medias, ¿entiendes? Primero es la comida. Entonces si fuera así, lo de tener que pagar al ir al médico porque el niño tiene una fiebre o comprarle cualquier cosa, súper complicado.
Doctors providing primary health care live and work within the community. This allows them to build a close relationship with the patients.
Es la única forma de conocerla inmediatamente, porque de lo contrario, de vivir lejos, no es posible un acercamiento grande con la población. Nosotros somos el puente para que ellos se sientan mejor desde el punto de vista de su salud, puedan tener una mejor calidad de vida y que tengan una esperanza mayor de vida.
Dr. Gisela's practice is one of the 25 practices managed by a neighboring polyclinic. Ariel is vice president of this polyclinic.
¿Qué pasa? Que con los consultorios médicos ya ellos tienen una dispensarización dentro del área por la doctora del médico de la familia, que es prácticamente el cura de la comunidad.
In Cuba, every pregnant woman has the right to prenatal care. Doctors monitor them closely during the pregnancy.
Próximo paciente.
Citizens are well looked after from cradle to grave.
Atención primaria tiene una premisa fundamental, es prevenir las enfermedades. Prevención y promoción. Promoción no es más que decir que promover la mejora de la calidad de vida del paciente. La alimentación, el estilo de vida saludable y ciertos factores que influyen totalmente en el paciente sano como tal. Y la prevención es que el paciente que no se enferme, que es la premisa fundamental de nuestro Sistema Nacional de Salud.
The Cuban healthcare system focuses on prevention. It's much cheaper and more efficient to prevent illnesses than to cure them. And while Cuba reaches similar healthcare results as the United States, it spends 15 times less per person. The focus on prevention is the key to the phenomenal success of the Cuban healthcare system. In the Philippines, the government also economizes on healthcare, not by putting the emphasis on prevention, but by privatizing healthcare more and more. This is why healthcare becomes less and less accessible and far too expensive for the poorer population. Maria is field officer for the Parañaque area of the Council for Health and Development.
CBHPs have trained community health workers like Emma. At the end of the training, they become health service providers. What they can do is to counsel the community to have a healthy lifestyle.
The CHD focuses its work in the communities on prevention. This way, the civil society group tries to prevent people from getting sick and from being confronted with huge healthcare bills. In fact, just like Cuba, but without support from the government and with very few resources.
So, binigyan ka yan?
Wala, kasi ang ibang mas karamihan sa Parañaque, mga mahihirap na hindi kaya magbayad ng ganung kalaking halaga para sa private hospital. Kaya nung nalaman nila na mayroong katulad namin na mga health worker dito sa Parañaque, mas pumupunta muna sila sa amin bago sa hospital kasi hindi kami nagpapabayad, serbisyo lang para makatulong sa area namin, sa aming lugar.
130 over 100 tika 8.
Hi, ate! Jerry!
Emma visits Jerry and his family regularly to see how they are.
Ako lang.
Because they live in a humid flood area, they often get sick.
Yung pangalawa ko po kasi, yung pangalawa kong lalaki dito kanina, yun yung unang-unang na hospital po. Nagkaroon po siya ng piksa, tapos nagkaroon siya ng hika, nagsabay-sabay nga po yun sa kanya. Ano po, buti po araw ng butuhan yun, yung asawa ko po naglakad po siya. Humingi siya ng mga tulong kung saan-saang mga gobernador, mga barangay, para lang po makabili ng sapat na pambiling gamot para sa anak ko.
The bill for Jerry's child's hospitalization was €300. That's a fortune if you only earn €4 a day. It was only the donations from the local politicians that helped save Jerry's child. The community health activists organize a feeding program for children of poor families like Jerry's. This way, the children have at least one good meal a day.
Hindi sila sa pagka-almusal kasi binabudget namin para sa pagkain namin hanggang maghapon. Minsan pag hindi po makakain yung mga anak ko, naiisip ko po yung hirap namin sa mga anak ko. Minsan inadaan ko na lang po sa iyak kasi hindi nga magkasya yung kinikita niya sa araw-araw. Tapos yun po, pag nakikita ko yung anak ko, parang nahihirapan din po ako sa sarili ko kasi hindi ko po matanggap na ganitong buhay ang masasangkam ng mga anak ko.
Kung ikaw ay masaya, tumawa ka.
Aside from improving the nutritional status of the children, we can reach out to their mothers. Hopefully, we will be able to convince these mothers to become community health workers as well.
Where good quality healthcare is not accessible for the community, health workers become a necessity. But with the limited resources they have, can they really make a tangible impact? We're back with Emma and the others on their rounds. One of Emma's patients lost her 7-month-old baby just last week.
Kaming isang community nanay na hindi naman natin gusto na mangyari yung kanyang anak na inilabas, may depresya at ito yung namatay.
Diyos mo yun, nakapasipayan.
Pwede namin siyang ipa-breastfeed dahil yung nanay ay malusog at marami siyang gatas. Pwede natin siyang ipa-feed doon sa kanya.
It may seem a simple solution, but without the community health workers, this baby may not have survived. Through solidarity and perseverance, community health workers manage to accomplish meaningful results. But as long as the government doesn't accept its responsibility, the health workers barely scratch the surface.
The work involves a certain level of health activism. Community health workers learn that it is in participating and organizing. There they can find solutions to the problems that the Filipinos face.
Today, people are demonstrating for the release of political prisoners. The government has become increasingly oppressive to activism, including health activism.
The health activism has been interpreted by the government as being anti-government. We are very much adamant about the labeling, the harassments, and even the killing of community health workers, especially in the rural areas.
Emma and Jerry are participating. They're convinced that health is related to other problems in society.
We have called upon our government to stop all of these and instead focus on serving the people who really need the services.
Health is a human right. By putting the emphasis on privatization, the Philippine government shirks its responsibility towards its citizens. Community health activists that try to help those in need are moreover threatened by violence and imprisonment. In Cuba, the right to health is guaranteed. Cuba's example shows that it is possible to achieve remarkable results with few resources. The right to health is thus a matter of political choice. By prioritizing the needs of the people over profit, quality healthcare and prevention can be made available to everybody.